Hi everyone, this is Nafis, and welcome to another episode of Medical Mayhem. This episode is called Mind, Ovary, Matter. So, let's get right into it. A 25-year-old woman presents with a generalized tonic-clonic seizure and fever. The seizure has been going on for more than 30 minutes with no improvement. She was brought in by her partner, who notes that she's been displaying increasingly bizarre behavior leading up to this. It began 1 month ago, with 2 weeks of flu-like symptoms, which included a headache, sore throat, cough, and diarrhea. When those all resolved, she became convinced that the government implanted a tracking chip in her liver, and she refused to leave her apartment as a result. She also said that Anderson Cooper was sending her secret messages from the TV to warn her about the government's plot to sell her severed head to Kim Jong-un for a nuclear agreement. The partner also said that she seemed to be having strange mood swings, going from laughing hysterically to crying within a matter of seconds. She has no past medical history except for an ovarian mass that was recently discovered on a pelvic ultrasound when she was being worked up for heavy menstrual bleeding. Okay, first things first. This seizure has been going on for a while now. When a seizure has been going on for more than 5 minutes, with no sign of recovery, that's called status epilepticus. Status epilepticus is a neurological emergency that can lead to devastating brain damage, and ultimately death. So we need to throw some anticonvulsants at her stat. But before we get to management, let's talk about what got her to this state in the first place. What was up with all that build-up to the seizure? She started becoming psychotic, and then all of a sudden she goes into status epilepticus. Are those two things related? Absolutely they are. There's a certain diagnosis that you should always have in mind when you get a young patient with new onset psychosis or any kind of personality change. It's called anti-NMDA receptor encephalitis. I know that's a mouthful. So what is that, you ask? Your brain cells have what are called NMDA receptors that the excitatory neurotransmitter glutamate attaches to, and that triggers brain activity. In anti-NMDA receptor encephalitis, you have these rogue antibodies that attack the NMDA receptors, and that wreaks havoc on the brain. Going back to the case, the ovarian mass that was mentioned has to be a completely irrelevant detail, right? Is there any possible way it can actually be related to the anti-NMDA receptor encephalitis? You bet there is. Ovarian teratomas are a type of ovarian tumor that's associated with anti-NMDA receptor encephalitis. Over half of female patients over the age of 18 with anti-NMDA receptor encephalitis have an ovarian teratoma of some sort. Teratomas are wicked tumors. It actually just happens to be my favorite tumor. The name teratoma essentially means monster tumor in Greek, and for a good reason. Teratomas arise from pluripotent stem cells, which are cells that have the ability to differentiate into several different cell types. That means that the clump of cells in this tumor have plenty of options for what they want to be when they grow up. And different cells can choose different things. Some decide they want to form skin, others teeth, some hair, and so on and so forth. In the end, you get this tumor that's a hodgepodge of different things. You literally have a tumor with skin, hair, and teeth growing inside of you. Sometimes this gets even further out of control. There's been reported cases of skin cancer arising from the skin tissue within the teratoma. So you literally have a cancer within a cancer. And in one case, there was even a mini brain that came out of the teratoma. That's right, a brain within your ovary. Imagine that. If this tumor with hair, teeth, and skin can develop a primitive brain, you almost wonder if it's possible for this thing to become sentient, and there'd be some sort of ethical issue with surgically removing it. Anyway, the presence of brain tissue in the tumor is relevant. When you have something growing inside your body like a teratoma, your immune system knows it's not supposed to be there, and it tries to do something about it by producing antibodies against it. The antibodies specifically attach to little molecular pieces called antigens on the thing it's trying to get rid of. Turns out that some of the teratoma might contain some brain cells that have some antigens that the antibodies can attach to. If those antibodies can attack the brain cells in the teratoma, who's to say they can't get to the brain cells in your actual brain? The same antigen in the teratoma that's getting your immune system worked up could also be present in your real brain. If the antibodies find their way there, then all hell breaks loose. The antibodies specifically recognize the NMDA receptors on your brain cells. These antigens that are targeted by the immune system seem to be disproportionately present in the limbic system of your brain. The limbic system is where emotional processing occurs. And it just so happens to be overactive in schizophrenia, which gives rise to the psychotic symptoms you think of with that condition, like delusions and hallucinations. So when the antibodies attack and things go haywire, That explains her delusions of persecution by the government and her emotional instability. All that inflammation of the limbic system will eventually give rise to seizures, which can propagate to the rest of the brain. And that's exactly what happened here, as we know that after becoming psychotic, she went into status epilepticus. The classic presentation for anti-NMDA receptor encephalitis is a viral-like illness followed by unexplained psychotic symptoms, and seizures can happen as well. And once again, if we go back to the case, we clearly see that our patient has followed this trajectory. She had that prodrome of a viral-like illness with a sore throat, cough, and diarrhea, and then the onset of psychotic symptoms like delusions of persecution and social withdrawal. And that all finally culminated in status epilepticus. We can confirm the diagnosis by looking at her cerebral spinal fluid and finding these antibodies. Let's say the autoimmune panel came back positive for anti-NMDA receptor antibodies in her CSF. So we're now basically certain this is anti-NMDA receptor encephalitis. Now the question is, what do we do about it? Hang on to that thought. That's a question we're going to answer in the second video, which will be called Seizing the Moment. Stay tuned, folks. In summary, a prodrome of flu-like symptoms followed by new onset psychosis, particularly in a young person, is suggestive of a potential diagnosis of anti-NMDA receptor encephalitis. This condition is associated with ovarian teratomas, which are tumors that can consist of many different types of tissue, and that includes brain tissue. In anti-NMDA receptor encephalitis, you get antibodies that attack the NMDA receptors in the brain, and these antibodies seem to have a predilection for the brain's limbic system in particular. The limbic system is the same thing that's faulty in schizophrenia, and it's what gives rise to the psychotic symptoms like delusions and hallucinations. This may explain why new onset psychosis is characteristic of anti-NMDA receptor encephalitis. Finally, the inflammation arising in the brain from this condition can precipitate seizure activity, the most serious consequence being status epilepticus, which is what happened in our patient's case. Again, stay tuned for the next video where we'll discuss how we proceed from here. Thank you very much for watching this episode of Medical Mayhem. If you enjoyed it, please like the video, share it with your friends, and subscribe to the channel. Until next time, this is Medical Mayhem.